What if I told you that one of the strongest weapons you have against high blood sugar isn't locked inside a pill bottle, but hiding in something so ordinary, so basic, that you've been overlooking it your whole life? The timing and method of drinking water. I know what you're thinking right now. That sounds way too simple. You've been drinking water since you were a kid. How on earth could that make any real difference to your diabetes? Or maybe you're sitting there feeling skeptical because you've already been down this road too many times. You've tried the supplements that did absolutely nothing. You've forced yourself through diets that were impossible to stick with. You've listened to advice that sounded brilliant, but never actually moved your numbers in the right direction.
My name is Dr. Andrew Collins.
And over the next few minutes, I'm going to walk you through exactly how the right hydration timing can boost your insulin sensitivity by as much as 40%. I'm not talking about theoretical patients from medical textbooks. I'm talking about real human beings. People in their 60s and 70s who never skip their medications. People who follow their meal plans down to the last detail. People who measure every single portion. People who test their blood sugar 3, 4, 5 times a day. People who get up every morning and take their walks without fail. And yet their numbers bounce all over the place. Their energy stays in the basement. Every time they get their A1C results back, there's this knot of dread in their stomach. The frustration I see in my clinic is crushing. These are people who've been locked in this fight for years, some of them for decades. They've spent their hard-earned money on special diabetic meals and foods. They've walked away from foods they truly enjoyed. They've followed every single instruction their doctors gave them. And honestly, they're exhausted. Exhausted from the never-ending monitoring. Exhausted from this constant feeling that they're doing something wrong, even though they're working harder at this than anyone else they know. In all my years working with patients, I've discovered something that changed how I practice medicine. The most powerful interventions aren't always the most complicated ones. Sometimes the basics we've been ignoring this whole time are what create the biggest, most measurable shifts. Recent research from major medical institutions has shown us something that honestly surprised even me. Drinking water at precise times during your day can improve your insulin sensitivity by up to 40%. Think about what that actually means. Your body gets dramatically better at using the insulin it already has. Whether that insulin is coming from your own pancreas or from the medication you're taking, here's the part most people miss. This isn't about chugging more water. It's not about carrying around a gallon jug all day. It's about when you drink it, how you drink it, and what you're adding to it. Small, strategic shifts in timing can produce substantial improvements in how your body handles blood sugar. Before I go any deeper into this, I want to know something. Where in the world are you watching this right now? Drop your country or your city down in the comments. I genuinely love seeing how far this information reaches, and it's a good reminder for all of us that this struggle with blood sugar doesn't care what continent you're on. We're all dealing with this together. Now, I need to be crystal clear about something. This is not about throwing your medications in the trash or ignoring what your doctor tells you. This is about giving your body the basic foundation it desperately needs so that your medications can actually do the job they were designed to do. Let me walk you through what's actually happening inside your body as you get older. Once you understand this, everything else is going to click into place. After you hit 60, several major biological shifts happen that make controlling blood sugar genuinely harder, even when you're following every rule perfectly. First, your cells slowly start resisting insulin. They don't respond as fast or as well when insulin shows up trying to push glucose inside for energy. Second, your pancreas stops making insulin as efficiently as it used to. You're basically operating with less of this absolutely critical hormone flowing through your system. Third, your kidneys lose some of their filtering power. They don't clear glucose as effectively anymore, so excess sugar just sits there in your bloodstream for longer instead of being flushed out. And here's the piece that most people miss completely, including a shocking number of doctors. Your brain's thirst signal gets weaker and weaker as you age. That last one is absolutely critical, and here's why. You can be seriously dehydrated, even at a dangerous level, without feeling thirsty at all. Your mouth won't feel dry, you won't feel uncomfortable, but deep inside your body at the cellular level, everything is breaking down. And here's what shocked me when I first learned this. Even mild dehydration, just 2% below where your body needs to be, which you won't even notice, can spike your blood sugar by 10 to 15 points. That's the difference between good control and poor control. That's what's causing those maddening morning spikes. That's why you're getting those random afternoon highs that seem to appear out of thin air for no logical reason. Let me tell you about a patient of mine named Gerald. He was 68, and I could see the frustration etched all over his face before he even sat down in my office.
Dr. Andrew Collins.
And I could hear the emotion tightening his voice. I don't get it. What am I doing wrong? I'm eating carefully. I'm measuring everything. I take my metformin exactly when I'm supposed to. I walk 3 miles every single morning. I've completely stopped eating sugar and white bread. I've done every single thing you told me to do. Everything my other doctors told me to do. He pulled out this small notebook that was completely filled with blood sugar readings from top to bottom. Look at this, he said. Some mornings it's 145. Other mornings it's 185. Yesterday morning it was 162. This morning 178. Same exact breakfast every single day. Same steel-cut oatmeal. Same measured portion. But the numbers are everywhere. His wife spoke up quietly from the chair next to him. He tries so hard. Harder than anyone I know. But his A1C just keeps climbing. It went from 7.1 to 7.9 over the past year. We went through his entire routine step by step. His diet was excellent. His medication timing was perfect. His exercise was completely consistent. On paper, everything looked absolutely right. Then I asked him what probably sounded like the most random, unimportant question. Gerald, walk me through your exact morning routine from the second you wake up until you eat breakfast. He thought for a moment. I get up around 6:30. I check my blood sugar right away. Then I make coffee. I drink my coffee while I'm reading the news on my tablet. Then, around 7:30, I make my oatmeal and take my medication with a glass of water. I leaned forward. When do you actually drink plain water? He paused. I could see he was genuinely confused by the question. When I'm thirsty, I guess. Sometimes with my medication pills. Is that a problem? And there it was. The whole picture suddenly made sense. Gerald was going from 6:30 in the morning until 7:30 or later before he had any actual water. 8 hours asleep with no fluids. Then another full hour awake without hydrating. 9 hours total of his body getting progressively more dehydrated. We made some simple, strategic changes. Nothing drastic. Every single morning before his coffee, he started drinking warm water with a small pinch of sea salt and fresh lemon juice. 15 minutes before lunch and dinner, he drank a glass of room-temperature water. He carried a reusable bottle with him and sipped from it consistently all day long. 2 weeks later, he called my office. I picked up the phone, and his voice sounded completely different. Lighter, almost excited. My morning readings have been between 125 and 138 for the past week, every single day. I haven't had that kind of consistency in over 2 years. A month later, his average fasting glucose had dropped by 22 points. No medication changes. Not one. Just water consumed at the right times in the right way. I honestly thought you were a little crazy, he admitted with a real smile at his follow-up appointment. Water just seemed way too simple to actually matter. But I can't argue with what my glucose meter is telling me. The numbers don't lie. Before I show you the exact method that's been helping my patients get these kinds of results, I need to explain the 3 most common hydration mistakes I see over and over in my practice. You're almost definitely making at least one of these right now. Mistake number 1, waiting until you feel thirsty to drink. Thirst is not an early warning system. It's an alarm bell that only goes off after you're already significantly dehydrated. By the time your mouth actually feels dry, your blood has already thickened, your glucose levels have already climbed, and your insulin is already struggling to do its job efficiently. Think about it like this. Your blood is like a river carrying glucose to your cells throughout your entire body. When that river is full and flowing well, glucose moves smoothly to exactly where it needs to go. But when the river runs low, it gets thick, sluggish, slow-moving. Glucose gets stuck. It piles up in your bloodstream instead of being delivered to the cells that desperately need it for energy. Mistake number 2, drinking large amounts all at once. Some people go hours and hours without drinking anything, then suddenly chug a huge glass thinking they're catching up on hydration. But your body can only absorb about 200 to 250 milliliters every 15 minutes. That's roughly 1 cup. Anything beyond that just runs straight through to your bladder without actually hydrating your cells at all. It's exactly like watering a houseplant. If you dump an entire bucket of water on it all at once, most of that water just runs off the sides. The roots stay completely dry. But if you water it slowly and steadily over time, the soil absorbs it gradually and the roots get exactly what they need. Mistake number 3, drinking ice-cold water, especially first thing in the morning or right before meals. I know cold water feels incredibly refreshing, especially on a hot day. But ice-cold water makes your blood vessels constrict and narrow. When your vessels narrow, insulin has a much harder time reaching the cells that need it. Room temperature or slightly warm water keeps your blood vessels naturally relaxed and open, allowing insulin to circulate and work far more efficiently. This is especially critical in the morning and around meal times when your body is actively dealing with glucose. Now let me teach you the specific method I use with my patients. I call it the H3 method. H stands for hydration. The first 3 represents 3 key timing points throughout your day. The second 3 represents 3 essential elements that make this approach actually work. Let's start with the timing points. Timing point number 1. First thing in the morning. This is your single most important timing point of the entire day. The moment you wake up, before coffee, before breakfast, before you even check your phone or do anything else, drink 1 full glass of warm water, about 350 milliliters or 12 ounces. Here's the crucial part. Add a tiny pinch of natural sea salt. I mean genuinely tiny. Just what fits on the tip of a butter knife. And squeeze in the juice from about half a fresh lemon. Why these specific additions? After 8 full hours of sleep, your body isn't just dehydrated from lack of water. You've also lost electrolytes through normal nighttime processes. That small amount of sea salt provides sodium, potassium, and magnesium that actually help your cells absorb and use the water you're drinking instead of it just running straight through you. The lemon provides vitamin C and creates a slight acidity that helps stabilize how your body responds to your first meal of the day in terms of blood sugar. This simple morning ritual does something remarkable. It signals your adrenal glands to calm down. Those glands naturally pump out cortisol, your stress hormone, which peaks every single morning. Cortisol tells your liver to dump stored glucose into your bloodstream. By calming this stress response with proper hydration and minerals, you actually prevent that unnecessary morning blood sugar spike. Let me tell you about Elizabeth. She was 72. She'd been managing type 2 diabetes for 14 years, and her biggest frustration was her morning blood sugar. She'd wake up consistently at 165 or 175, even though she'd eaten a careful, measured dinner and her bedtime reading had been perfectly fine. We started with just this one single change. Warm water with a small pinch of sea salt and fresh lemon juice first thing every morning, at least 20 minutes before her coffee. 3 weeks later, her average morning reading had dropped to 128. Same medication dosage, same evening routine. The only difference was how she started her day. I wake up feeling genuinely different too, she told me at her follow-up visit. More clear-headed, less foggy and confused. And that lower morning number gives me confidence and momentum for the whole day. Timing point number 2. Before meals. About 15 minutes before lunch and dinner, drink a smaller glass of water, about 150 to 200 milliliters. Just 1 cup. This simple habit does something physiologically important. It prepares your entire digestive system. It stimulates enzyme production. And most importantly for blood sugar management, it slightly dilutes the contents of your stomach, which directly slows down how fast carbohydrates get absorbed into your bloodstream. When carbohydrates enter your bloodstream slowly and gradually instead of all at once in a sudden rush, your insulin can actually keep up with the demand. Your blood sugar rises gently and steadily instead of shooting up dramatically. Clinical studies have shown this remarkably simple habit can reduce post-meal blood sugar spikes by up to 20%. That's often the difference between struggling with control and genuinely good management. Timing point number 3. During physical activity, if you walk, garden, do household chores, or engage in any sustained physical activity for more than 20 minutes, you absolutely need to drink water during that activity, not just afterward when you're already depleted. Aim for about 100 to 120 milliliters every 15 minutes of sustained activity, small, frequent sips rather than large gulps. This consistent hydration keeps your blood volume stable and prevents the blood sugar swings that commonly happen with physical activity in people with diabetes. Now let me explain the 3 essential elements. The second 3 in the H3 method. Element number 1, temperature matters. Room temperature or slightly warm water is optimal, especially first thing in the morning and before meals, about 22 to 24 degrees Celsius or roughly 72 to 75 degrees Fahrenheit. Cold water isn't bad in itself, but warm water keeps your blood vessels naturally relaxed and open, allowing dramatically better insulin circulation and delivery. It's a small difference that compounds significantly over time. Element number 2, minerals matter. Pure, demineralized water alone isn't enough. Your cells need minerals to actually absorb and use water effectively. That tiny pinch of sea salt in your morning water provides those essential minerals. Natural sea salt contains sodium, potassium, and magnesium in proper balance. Avoid regular processed table salt. It's been chemically stripped of these vital trace minerals. Choose unrefined sea salt or Himalayan pink salt that still contains the full spectrum of minerals your body genuinely needs. Element number 3. Timing consistency matters profoundly. Your body absolutely thrives on predictable routine. Drinking water at consistent times every single day helps regulate your entire metabolic system. Morning water at the same time, pre-meal water at regular intervals. This consistency directly helps stabilize blood sugar patterns over time. There's one more addition I consistently recommend for my patients. About 1 hour before bed, drink 1 final glass of warm water with 200 milligrams of magnesium citrate or magnesium glycinate dissolved into it. Magnesium is absolutely crucial for proper insulin function, and the vast majority of people over 60 are clinically deficient. Taking it before sleep serves a dual purpose. It helps your muscles relax for deeper, more restorative sleep, and it keeps your blood sugar significantly more stable throughout the entire night. Everyone asks me this exact question. Doctor, precisely how much water should I actually be drinking each day? Here's a simple practical formula. Take your current body weight in pounds and divide that number by 2. That resulting number in ounces represents your baseline daily water intake requirement. For example, if you weigh 160 pounds, you need about 80 ounces daily. That's roughly 10 standard cups. If you exercise regularly or spend substantial time in warm weather, add 1 extra cup for every 20 minutes of physical activity or heat exposure. How do you know if you're drinking enough? Look at your urine color. It should be pale yellow, similar to lemonade. Not completely clear, which means you're actually overhydrated. Not dark yellow or amber, which signals dehydration. Pale yellow is the optimal target. Here's a practical implementation strategy. Get a reusable water bottle that holds about 24 ounces. Fill it completely 3 times throughout the day. Once in the morning, once at midday, once in the afternoon. That's 72 ounces total. Perfect for most adults. Keep that bottle constantly visible. On your kitchen counter, on your work desk, in your car. Visual reminders work far better than trying to remember on your own. So what actually happens when you begin this method? What should you realistically expect? In the first week, you'll probably feel like you're running to the bathroom constantly. This is completely normal and expected. Your body is simply adjusting to proper hydration levels. This settles down significantly by week 2. You should notice your morning blood sugar beginning to stabilize, maybe 10 to 15 points lower on average. Not a dramatic overnight transformation, but consistent, measurable improvement. By weeks 2 to 3, you should experience noticeably more stable energy throughout the entire day. Less of that frustrating afternoon energy crash. Your post-meal blood sugar readings should become substantially more predictable and consistent. By week 4, if you check your A1C, you might see it beginning to trend downward. Not necessarily a huge drop immediately, but clear movement in the right direction. And here's what I hear most often from patients. Doctor, I just feel genuinely better. I can't quite explain it precisely, but I feel more like my old self again. That's what proper hydration creates. It doesn't cure diabetes. It doesn't replace necessary medication. But it helps your body work the way it's actually designed to work. Let me be absolutely clear about something critical. This is not a replacement for proper medical care. If you're currently taking diabetes medication, do not stop. If your doctor has you following a specific management plan, continue following it faithfully. What this hydration method does is support your existing medication, making it work significantly more efficiently within your body. I've had patients who, after 3 consistent months, were able to reduce medication dosages under their doctor's careful supervision. Not because water replaced medicine, but because their body's entire metabolic system started functioning more optimally. If you have any degree of kidney disease, talk directly with your physician before substantially increasing water intake. For most people, this approach is completely safe and highly beneficial. But if your kidneys aren't filtering properly, you need individualized professional guidance. If you're taking blood pressure medication, pay close attention as you increase hydration. Proper hydration can naturally lower blood pressure, which is genuinely beneficial, but might require medication dosage adjustments. Watch carefully for any dizziness and report it to your doctor immediately. Let me tell you about Dorothy, who was 74 when we first met. Dorothy had been managing diabetes for 19 years. Multiple medications, various restrictive diets, diabetes education classes at the hospital. She understood carbohydrate counting better than most registered nutritionists, but her A1C had been steadily creeping upward. It was now 8.6, and her endocrinologist was seriously discussing starting insulin therapy. "I feel like I've completely failed," she told me quietly, her voice breaking slightly. "I've done absolutely everything right for 19 years, but my body just keeps getting worse and worse. Maybe this is simply what happens. Maybe I can't fight it anymore." Her hydration habits were terrible. Maybe 3 or 4 small glasses of water daily, if that. Coffee in the morning, tea in the afternoon. But actual plain water, very little. "I never feel thirsty," she explained, "and honestly, I hate constantly using the bathroom. It's embarrassing when I'm out with friends." We started the H3 method together. Yes, for the first week or so, she'd need the bathroom more frequently, but I assured her that her body would adjust within 10 to 14 days. 6 weeks later, she looked noticeably younger when she walked into my office. Eyes brighter, skin healthier, actually smiling. "My numbers have been the absolute best they've been in 5 years," she said, proudly showing me her glucose log. "My average used to hover around 185 to 205. Now I'm consistently 145 to 165. My doctor actually reduced one of my medications, but she said it wasn't just about the numbers on the meter. I have genuine energy again. Real sustained energy. I can think clearly without that constant fog. I even started gardening again. Something I'd completely given up on 2 years ago." 3 months later, her A1C results came back at 7.3, down from 8.6. "You gave me my life back," she said, tears streaming down her face. But they were happy tears. With water. Something that costs virtually nothing. I just wish someone had explained this to me 19 years ago when I was first diagnosed. Dorothy's story is exactly why I create these educational videos. Because there are thousands of people exactly like her struggling right now, trying so incredibly hard, feeling completely defeated. When sometimes the answer is genuinely simpler than anyone could imagine, I want to challenge you personally to try this approach for 14 days, just 2 weeks. Follow the H3 method exactly as I've outlined it. Morning water with sea salt and lemon first thing upon waking. Water 15 minutes before lunch and dinner. Proper daily water intake spreads consistently throughout the day. Magnesium water before bed. Track your blood sugar carefully during those 2 weeks. See for yourself if the numbers improve. Pay genuine attention to how you feel. More sustained energy, clearer thinking, better quality sleep. If after 2 weeks you observe real improvement, keep going. Make this your permanent new normal. And please leave a comment telling me what you noticed. Your personal story might be exactly what another person desperately needs to hear to give this method a serious try. If you made it all the way to the end of this video, please type "I watched" till the end in the comments below. It genuinely helps me understand that this message is reaching people who truly need it, and it helps YouTube share this vital information with more people struggling with blood sugar management. And then tell me, are you going to try the H3 method? What's your biggest struggle with staying hydrated? Share your thoughts in the comments. I read every single message. If this information was genuinely helpful to you, please share it with someone who's struggling with their blood sugar, a parent, a spouse, a close friend who could benefit from this simple, practical strategy. And if you haven't already, hit that subscribe button and turn on notifications so you never miss future videos on managing diabetes, improving metabolic health, and living well with chronic conditions. Take care of yourself,